So let's go ahead and reveal the keyed correct answer. And as all of you got, the correct answer was D, toxin-induced direct endothelial damage. Dr. Nori, any thoughts?
Absolutely. I am really glad to hear how you are all thinking and approaching this question. As Stephen pointed out, the dramatic rise in this child's serum creatinine, presumably it is normal at baseline, and to have this degree of kidney failure in such a short time is definitely a characteristic of this particular illness. Shakira, a really nice job in identifying the fact that this is hemolytic uremic syndrome. And the most likely exposure, as we stated, is something that happened at the petting zoo. So while the classic scenario you may learn about is, I guess, tainted hamburger meat, there's lots of ways to be exposed to this illness because basically it is a toxin-mediated illness, as lots of you, including Cezanne, had identified. And so this might be seen in really any kind of animal or animal product exposure. The rapidity of the illness and the very short incubation time seemed to be key for a lot of you, and it helped you arrive at the right answer, which is that this is a toxin-induced illness, which causes direct endothelial damage, which manifests in the profound kidney failure, in the normocytic hemolytic anemia, and several other disease manifestations. When someone such as myself goes about creating an item like this and thinking up the choices, it is very true that we may select some that are directly related to infectious processes and others that may be non-infectious. And so it's rather hard to come up with these sort of mechanistic types of questions. And so you all identified very correctly that not all of these can be attributed to infection. Several of these are other perhaps acquired conditions or conditions related to other disease states, but not necessarily related to infection. So just to kind of sum it up, the short incubation, the animal exposure, the anemia with the profound kidney damage all points at the correct answer, which you all successfully arrived at, so congratulations.
Now, we know how our exceptional group of medical students performed on this one question in this one small exam. It might be useful to see for reference what we call item analysis and how this item has performed on our actual exams in the past. So here's the item analysis statistics for this specific item. And as you can see, about 250 students saw this. It had a p-value of 73%, meaning 73% got it correct. And most students, whether they were in the high or low performing group, tended to go for D, but the second most common choice was E. Any thoughts about that, Dr. Nori?
So E is a good second choice, I would say. And this is because going back to what we discussed previously, some of these choices are related to some type of infection and some just are not. And so the other one that may plausibly be a consequence of an infection is something like immune complex deposition, which can then lead to kidney failure in a condition such as post-streptococcal glomerulonephritis and several other types of infections. But of course, the common one being a group A strep infection. So the fact that choice E is the second most frequently selected choice still makes me feel pretty good as an ID instructor that these students are on the right track.
Thank you, Dr. Nori.